Good morning. Thanks for listening. My name is Dr. Sandra Dorman, and I'm a researcher and professor in the School of Kinesiology and Health Sciences at Laurentian University, but I'm also the director of the Center for Research in Occupational Safety and Health. And today I wanted to talk to you about what I did my PhD in, because when I went to school, I was always really interested in how the body worked, right? We call that physiology. And I was also interested in how medications changed how the body worked, which is called pharmacology. And so I did my PhD in physiology and pharmacology. And the disease that I looked at was asthma. And so I'm going to talk to you a little bit about that today. And the topic is asthma and the bone, unexpected relationships. And that's because, when we think of asthma, we think of the airways. But I'm going to explain to you today how the bone actually supports asthma when it's happening in the airways, and also how we want to treat asthma. We usually want to stop the activation of the bone too. So let's dive in. So asthma is a really common disease in Canada. It's actually the third most common chronic disease, and it's the #1 in children. And probably some of you that are listening to this today have asthma. That's because over 3 million Canadians suffer from asthma, and a lot of them are children under the age of 12. Now, I put in this slide, about 250 people die annually from asthma, not to scare you, but to remind people that we need to take asthma seriously. We need to make sure that people who have asthma are treated properly. We do note some interesting things that I'll just point out is that boys tend to have more asthma than girls do when they're children. But in adults, girls tend to have more asthma than boys. Okay, so for this topic, when we're talking about asthma, I'm going to talk about allergic asthma, because there's different types of asthma, like exercise-induced asthma, for example. We're going to talk about allergic asthma, and this is where you get exposed to something in your environment and it makes you have an asthma attack. And often it's something like pollen, so tree or grass, but it could also be cat dander or dogs. Some people are allergic to horses, dust. Those are allergies, right? And in an asthma attack, you inhale those allergies, they get down into your lungs, and they cause an allergic response in your airways so that you actually end up getting a constricting of the tubes in your airways. And those tubes are important because that's how we get air in and out of the lungs. You can see it's a lot harder to breathe when the tube is all crinkled up, right? It's hard to get air through. And that's how people feel when they're having an asthma attack. It's hard for them to breathe, right? And they'll feel that. So what's in science, we always like to measure symptoms that people are having. So one of the things that we do is this thing called spirometry. And this is where we actually measure how well a person is breathing. So here's a cartoon picture of it over here. Some of you may have done this, but here's a man, and he's basically being instructed to take a deep breath in and then to blow out into this tube as hard as he can and as fast as he can. And this machine is measuring how much air he's actually able to move. And when someone's having an asthma attack, which is shown in this diagram over here, the amount of air that they can forcefully push out of their body, like, it decreases. And you can measure that drop, right? And usually, so this picture is kind of showing somebody, they came in and they were breathing normally, and then they were exposed to an allergen, and that caused them to have a harder time breathing. But usually within about 20 minutes to half an hour, they're back to breathing normally again. Now, for some people, a few hours later, often when they're sleeping or they've gone to bed, they start having a harder time breathing again. Okay, so we call this the early response to an allergen, and this is the late response to an allergen. So what's happening? Well, this picture is showing you the early response. So we've got pollen, maybe it's cat dander, oh, those rascally cats. You're inhaling that into your lungs, and this is a close-up of your lungs, and you can see that your immune system is attacking that allergen, and it's actually causing an inflammatory reaction. Remember, inflammation is like when you get red and hot and swollen. Imagine that's happening in your airways, okay? And when that happens, the muscles constrict and the tubes get a little bit filled up, and they, then it gets harder to breathe. Now, that's all happening in the airways, but I want you to know the immune system is bigger than the airways. And one of the things that supports the immune system is actually your bone, and specifically your bone marrow. So see in this picture, you can see this dark red part. That's the inside of bone, and the inside of bone is called bone marrow. And the bone marrow is responsible for making all of the cells in your blood. So your red cells, your white cells, your platelets, and especially those white cells, those are important in causing inflammation. And so those are contributing to what's happening in the lungs. So when you're having an inflammatory response in the lungs, there's actually a signal that is released to your whole body that goes to the bone and says, hey, bone marrow, we're having a problem in the lungs. Can you send backup? And so the bone marrow, where all the cells are being made, it releases more cells. And those cells travel through the blood to the lungs, and then they start to cause more inflammation in response to the allergen too. I mean, it's not a very nice party, but if you think of the cells attacking all of the pollen that you inhaled as a party, the early response are the cells that were already at the party. The late response are all the cells that are coming from the bone marrow to join the party, right? Somebody said, hey, there's a party at 50 Alex Lane. And 3 hours later, a bunch more cells showed up. So if we look at that now in context of that spirometry graph, right? The early response now where you first couldn't breathe is just whoever was already in the airway is responding to the pollen. But these cells told the bone marrow that something was happening, and it took time for them to tell the bone marrow and for the bone marrow to get the message and then send more cells to the airways. And so that time is the difference between, when you were exposed to the allergen and then hours later. Probably, like I said, when you're sleeping, that you start to have a hard time breathing again, because now there's more cells making more inflammation in the lungs, and you feel kind of crappy again. So my last little thing is just to tie in the medication piece. There are lots of good medications that we use to manage asthma, and a group of them are called corticosteroids. And what they do is they suppress the immune response. And part of the reason why they work is they stop that message to the bone marrow, and they stop the bone marrow from releasing more cells. So these kinds of medications are particularly good at preventing you from getting sick later on at night from asthma, because they're acting on the bone marrow. So there you go. Asthma is happening in the lungs, but there's messages going on through your whole body, and drugs can alter those messages and have beneficial effects. So maybe now you want to study physiology and pharmacology. It's awesome. Thank you very much for listening to me. And thank you for the conference organizers and my co-presenters and all the volunteers. Let's have a good day.